reality. Welcome to our final session. We are trying, as we often do in Team Up, to practice what we are preaching to other people. And to that end, I have the good fortune to introduce an invited guest with us today, who's going to walk us through a wellness activity. We figured post-lunch it wouldn't be bad to just do a little bit of centering ourselves and rejuvenating ourselves for the rest of our day. So this is Christian Baird. Christian is a certified pranic healing practitioner and licensed instructor. He is the mentorship coordinator for the American Pranic Healing Association and mentor for the certification program under the Center for Pranic Healing located in New Jersey. He currently works with clients through his private practice in Massachusetts, as well as throughout the United States on a virtual platform. I think we know that well. It's a wonderful way to do things. He teaches MCKS, yes, MCKS Pranic Healing in New England, hosts meditation at Twin Hearts, and hosts Arhatic yoga review sessions. In 2014, he co-founded Atlanta Pranic Healing Center, LLC. And in 2018, he founded Pranic Healing Boston and Integrative Wellness. Christian, welcome.
Thank you. I like that. So thank you for having me here. And I just, before we go into the actual practice, moving of the body, some deep breathing, I just wanted to touch upon the importance of taking care of yourself. All right. So I know a lot of you take care of others, and that takes a great deal of strength internally to be able to always be present for the people that you're helping, not only in an individual sense, but families, and in the bigger sense, trying to create systemic change. And in order to continue to do that, you need to take care of yourself, whether that's dealing with your stress, trying to energize yourself so you don't burn out. And today, we just do a short practice, moving of the body, because I've heard that you guys have been sitting all day. And then what we'll do is some breathing. And that deep breathing will be to help de-stress you, and to also to energize you. Very simple, but very effective. So I hope you'll keep an open mind and be willing to go through this together. And the importance I wanted to make about the mind-body connection. I was thinking about this earlier today, and I was thinking, well, if I think about the hot chocolate that I want, eventually I'm going to get that hot chocolate. So whatever it is, if it's coffee, a candy, whatever it is that you're doing, lunch, whatever you think about, eventually your body will follow. So I just wanted to touch upon that. So if you're stressed and thinking about that problem, maybe that problem will happen more than what you're looking for. So I just wanted to talk about that for a brief moment. And then when we're doing this exercise, hopefully you can think about something that keeps you happy and smiling. And that will be the invitation for when we do this. And if something else comes up, okay, just watch it as if it's a movie. Yeah, okay, you're there. Nice to see you. And eventually it will go away. So with that, we're going to stand up. It's going to be interesting. Is this connected to Zoom? Yes. Yes. Okay. All right. So this is going to be fun. All right. So, oh, good. All right. The first thing you're going to do is keeping your head straight. Eye rotation. So this is basically moving your head, keeping your head straight, eyes looking up. And then what you'll do is then looking to your right and then to the floor. So it looks like this if you want to look at me. Up, looking to the right, down as best as you can, looking at the floor, to the left, and up. And just keep going to the right. Big circles to the right. Continue to do that for a few moments. Okay, very good. Now switching direction, looking to the left side of the room, the floor, to the right side of the room, and the ceiling, and repeat. Okay, very good. Now looking forward, um, if you can tell, it's already kind of changed. The environment has already changed in the room. If you need to take a deep breath while you do this, please do so. Okay, now looking left and right, this is for the neck. And last one. Okay, looking forward. Now upper body twist. So this is, you can bend your knees just slightly and then having your hands up like this, palms facing down. And then if you can look over your shoulder while doing this, go ahead and do that. You might need a little room, so make sure you swiggle around. Okay, and then gently twisting left and right. We'll do this 4 times. So 2, 3, and 4. Hopefully no one got hurt. Next, we'll go to the hip rotations, okay? So with this, moving the hips. So rotating the hips to the right, okay? Good, I'm glad people are laughing and smiling. All right, switching direction the other way. All right. Next, we'll move into some squats. So just gentle bouncing like this. Perfect. Now let's just move the shoulders, okay? Shoulders backwards. Okay, now let's switch direction, moving forward. Perfect. Okay, just a couple more here. Bending of the elbows. I won't be able to do both hands, but bending both elbows at the same time. Wrist rotation. Switching direction. Beautiful. Okay, now if everyone will have a seat, we'll move into the breathing. As you're ready, bringing yourself, if you feel comfortable, you can close your eyes. If not, you can keep them open. Here, we'll do some deep breathing. Now, at any point, if you're feeling any discomfort, just go ahead and breathe normally. That way, you can just be in the stillness and the energy. Now, this breathing will be done through the nose. So gently exhale everything out. Briefly hold. Inhale through your nose. Hold. Exhale through the nose gently. Hold. Inhale. Hold. And exhale. 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 Hold. We'll do one more inhale. Hold. And exhale. Hold. Breathe normally. Do not control your breathing. If at this point you'd like to close your eyes, you're welcome to. Be aware of the inhale and the exhale. You're not controlling your breathing, simply being aware, allowing your mind to relax, being aware of the inhale and exhale. And when you're ready, now moving into being aware of when you inhale, there's a gap before you exhale. If you can be aware of that space between your inhale and exhale. Remember, do not control your breathing, just breathe regularly. Be aware of the space after your inhale and after your exhale. Just be aware. Very gently start to move your fingers and your toes, and they come back. When you open your eyes, if you want, you can smile. So when you're ready, we're gonna stand up again. We're gonna do the same movement to kind of integrate that energy, because energy was generated during that breathing. We need to incorporate it in the body. Okay. So let's stand up again. And then we'll do eye rotations, looking up, and eye rotations to the right, looking to the right, the floor, left, and the ceiling as best you can. Okay. Okay, switching direction to the left. Okay, very good. Looking left and right. Perfect. Let's do the upper body twists, create some space, and twisting left and right. Okay, everyone's favorite, hip rotations. All right, switching direction. All right, let's do semi squats. So small bounces, just bending the knee. Moving to the shoulder rotations backwards. Moving them forward. Bending the elbows. Wrist rotations. Other direction. Beautiful. If you have a seat, I just wanted to just one more remark. So how are you feeling? Feel good? Yeah. So that's something you can do. I want you to take that with you. Okay. So inhaling, hold, exhaling, hold. And just do it for about 4 to 7 breaths. That will generate, well, it reduces your stress level, helps you to clearly think, and then you have more energy. Okay. And then movement of your body, or even gentle tapping or just massaging of the body after you do that will change your whole day. I do this. I have, just as a quick side note, I have a business. I work full time. I'm part of an association and I'm a mentor. I probably work 100 hours a week all at the same time. So, and I know you're busy as well. So please take this with you, use it, and continue what you're doing best. And thank you.
Thank you so much, Preston. Really appreciate that. All right, so for the folks who are here for the end of our session, we now have the part 2 of our video storytelling project. So let me just get that loaded up.
If you don't want to get up every day and say, I'm going to survive, I'm going to feed my kids, put them on the bus, they have a roof over their head, that's good. No, it's more than that. It's a lot more than that. And breaking the cycle, breaking that cycle of trauma. And I think we're doing that now. We have an integrated behavioral health team. We have a community health worker. So they're trusting people to open it up and get it out. And they're given tools in exchange to say, it's okay to be mad. It's okay to feel sad. This isn't normal. It can be better.
We do our best to hire staff that matches the population that we serve so that we are able to better understand the cultural needs of our patients and to meet those needs.
We're supposed to meet patients where they're at, and that includes their culture. So what makes sense to one culture doesn't always make sense to another culture. It's because mental health is categorically different in different cultures. A veces tienen miedo, los pacientes tienen miedo de venir y no ser entendidos. Y es importante que ellos sepan que tienen una facilidad, que están ahí para ayudarlos y que ellos puedan buscar la ayuda que necesitan, sabiendo que ellos van a recibir en el idioma de. Being immersed here, I've learned so much about all the different cultures. and letting the patients lead the way is the most important thing.
Cultura hispana no cree en mental health, entonces es más de hablar con los padres y dejarles saber los problemas, dejarles saber los beneficios que trae que ellos que busquen ayuda por sus hijos, porque a veces ellos no creen. Entonces, yo creo que mi rol es advocando por los pacientes y haciendo un poquito de conciencia sobre la salud mental y cuán importante es buscar ayuda para la salud mental.
There was a mom that had severe postpartum depression. She had the business card from the community health worker. She didn't call anyone but her. And she told her about it and she said, I need help. The community health worker met her at her house, brought her here, and because she formed that relationship, she reached out and she got help. Because what would have happened if she didn't have that person? I say that every day, the integrated behavioral health team with community health workers, they save lives.
The community health workers help our patients and give them the resources to not only help them, but also foster independence for them to feel that they can go out into the community and get these resources on their own.
Benefits mean that I don't feel like I have to know everything. I can depend on my team to be experts at their fields. And that's just like an incredible weight off my shoulders.
It provides a lot of benefit to us as the providers and our own mental health, because I don't have to be going to bed that night thinking of like, is that kid sleep? Did I do the right thing? Because somebody has followed up on that for all of us. And that's been tremendously helpful for the patients and for all of the members of our team, because when you don't have to carry that worry into your next visit, or you don't have to be running chronically a large amount of time behind, it's been great for all of our mental health over the past couple of years that we've had Team Up on board for us.
One of my favorite questions is to ask what children want to be when they grow up. Many, especially in the past couple of years, have expressed an interest in either becoming a nurse or becoming a pediatrician specifically. There's not really anyone better to then later provide those services, knowing what their needs were and being able to meet those and have open conversations about them and like really be able to kind of full circle, bring everyone together.
From the providers to the nurses, the medical assistants, behavioral health, our secretaries, everybody is so integrated with each other that it really is just one big department. And everybody that's here truly wants to be here. They love these kids. We all love these patients.
It's like countless ways that we serve the community and that the community in turn gives to us as well. It's like being in a neighborhood.
Can tell from the giggles that these people are in the audience here, so. Thank you once again to everybody who participated in that. There's nothing better than being in a conference and watching yourself up on screen. That's its own fun thing to do. So we have, I think, about 20 minutes left. And the one thing that we wanted to do and wrap up was to come back to those original two questions and ask for your feedback. If a member from our team, I don't know if any of you guys want to come up and maybe just scribe here as people talk, that would be great. Looks like Sonia's volunteered herself to come on up. Thank you. And thank you, Sonia. We have two Sonias on our team. So I'll just remind everybody what the two questions are. For folks who are watching remotely, you can use your chat as well. Elijah's watching the chat and we'll make sure that we bring that into the room too. So the first question is, if you think 3 to 5 years into the future, what is the change that you want to see? And the second part of that is, what opportunities do you see to help us collectively get to that change? Cannot believe that nobody has a thought on this. So yeah, but I do need you to use the mics or we can have runners. Can I get a couple?
I'll bring that with me when I go back. Prevention, more preventative care. We have the preventative care codes, which is a great start. But learning how to take that and move forward closer to what true prevention is. Using the screeners as a catalyst to a preventative code doesn't make as much sense as being preventative before the screener. And that's where I would like to go.
Thanks, Kara. Just so for folks who may not be aware of what Kara is referring to there, currently to use the preventative billing codes, you do have to have a positive screener. With the work of the evaluation team, we've actually put together an analysis of data demonstrating that probably limits some kids who need services and in reality are getting services. The health centers are not necessarily able to bill and get reimbursed for all of those services now. So an area of advocacy too that we're working on. Who else would like to? Yeah, two right in the back there.
Yeah, I'd love to see sustainable deployment of CHW services across board. And I would love to see, the private sector and private sector initiative and business thinking around solving this problem.
Can you maybe go into a little, like, are there any opportunities or specifics that you would recommend that we think about?
Well, I think it's just applying our minds to this as a business problem and find solutions. It could be, someone had mentioned there's a difficulty with billing. There could services built around that, and just think through what would be a sustainable model for deploying CHWs across board.
Thank you. That's great. I think that has definitely been a resounding theme today, has been the impact of community health workers and family partners on basically the whole model, all parts. So on children and families, on their team members who they work with, and the impact that they're having at a system level. Hi, go ahead. Sorry. Thank you.
Access to treatment period for somebody with an autism diagnosis.
And any opportunities, any missed opportunities that you would point us to do that?
Insurance coverage.
There you go.
Because if you have CMSP or Mass Health Limited, you cannot get ABA services at all. So you can only see a mental health counselor, and they don't necessarily have the background in that behavior modification treatment.
Thank you for that. And really interesting that you bring that up. In the earlier talk on equity, we were talking about different ways to look at subpopulations within the broader population that the health center cares for and figure out ways to ensure access to care. And what you're talking about is a pretty significant systemic barrier for some populations. John, I think you raised your hand. Bree's right behind you. She'll bring the mic.
I think we mentioned figuring better ways to make it family care, not just kid or adult care.
Yep. So I will just note, I can't find Stephanie Doyle quickly, but Thank you. Right in the center, right in the front. Sorry. So Stephanie and Eve is somewhere here too, I think, unless she's. Okay. So Stephanie and Eve are from TPEC. You brought this up earlier this morning as well. So this is the Transforming Pediatrics and Early Childhood. It is a HRSA funded initiative. Team Up is honored to partner with DPH on that work. Interestingly, John, the HRSA requirements around data are at the family level. And Massachusetts was originally one of 4. Now there's 8. Is that correct? Of these projects nationally. And it sounds, I don't know, Stephanie, if I'm putting you on the spot, if you want to say anything about this, but it sounds like that is a universal deficit in across all these projects, is the ability to actually identify a family unit rather than identify only the patient or the child, but rather be able to do that. Trying to give the mic. Yep, absolutely. And there, I think Mass Health, I'm not an expert in this. My understanding is that they have some ways to try to, through proxy, figure out who's in the same household. But, you know, I think that's not ultimately what we would love a family orientation to really look like. It's, you know, kind of piecing together based on what's there.
They know the family. They don't do that analysis either.
Yeah, that's a good point. Yep. Yeah. Orientation. Yep. Thank you, John. Yes.
It's not a question, it's just a comment. I'm so grateful to be here, walking but not walking. Walking but not walking. Yeah. But I'm not sure, we just embodied that collaborative work and shared learning right there today. So I'm not sure if this exists already, but I would love to see a collaborative network exchange between health centers, so where they can share what they are learning, their experience, and what's working, what's not working. I think it's gonna just like you know, it's gonna reinforce the sustainability of our teamwork. Thank you.
Yep. Thank you for that. I think we observe that, you know, Sonia is the one who really heralds this on our team, but you know, we gained a lot in being able to stay connected through the pandemic, through a virtual platform. And I think we probably got to the end of optimizing that platform. And really, I think came around to feeling like there's nothing that replaces being able to really connect and spend a little bit of time together and do it in a, you know, kind of just good old fashioned, get in the same room and chat and share. Thanks. Yes, Nancy.
I think even though we're all have expanded access to our patient populations, we need to grow the workforce, the behavioral health clinicians and the community health workers, because the need is way greater than what we can supply.
Yeah. Yeah.
And I think one way that we might be able to certainly by offering social work students and people interested in CHWs, being a CHW, of the opportunities to intern, follow someone at a health center doing this work, I think could be really helpful.
So that was a very good segue to share a couple different things. One is that HRSA, also Health Resources and Services Administration, part of the federal government, recently put out funding exactly to do that. It was to place behavioral health clinicians in a variety of different positions within their academic experience in community-based settings, so that they were exposed to work in the community, whether it's primary care or a different community-based setting, but really got that opportunity to spend some time there and get support in that environment. BU School of Medicine, which is the LMHC program at BU, was awarded one of those training grants. Team Up is a sub-award within that, really is to essentially to bring those folks into the Team Up learning community and provide that level of clinical training and support. I think one of the things that we're excited about is the opportunity for that to expand the settings within which the people who are coming into that learning community experience. So will be a chance for us to talk to our colleagues in a community-based mental health organization who may be struggling with communicating with us when we keep saying that we're struggling with communicating with them. So a good chance, again, just to do a little bit of cross-fertilization. I also just will note Mia, our intern here, you want to wave, Mia? Mia's provided excellent technical assistance throughout the whole day today. Mia is an undergraduate student at BU and is doing an internship with us as well. So again, I think we try very hard to find ways to be able to make those opportunities happen. I think Charlotte and I have commented on this as well, that if you look back, a lot of us started in some type of job where we just got exposed to what this was like. And once we got exposed to what it was like, we just stayed in and we kept looking for different ways. So I think, you know, we really see that kind of pipeline development as an important component of Team Up's work too. Baby steps all the time. Other comments or feedback or suggestions? Yeah,
I would love that if we get to universal daycare or preschool, that we learn from the mistakes that we made as a larger community around, you know, lacking integration between different service providers and, you know, preparing the workforce, but also strengthening the communication between all of the caretakers for children, especially young children.
A huge part I remember from a presentation a long time ago that something like 75%, I don't know if that's absolutely correct, but a very large number of the placements that children are in for early education, preschool, are individual homes. They're private preschools, private daycares, which is a real kind of diverse and varied network, all of whom, though, are a constant force, a constant impact on the children that they're caring for. And so when you think about that type of opportunity to kind of align the approach to really fostering wellness for children, that's a huge part of that network. Any other thoughts? I see Schoon waiting to.
I would love to see a leadership development for these amazing Team Up direct care folks to have a pipeline for that, because I can't think of a lot of rooms where the change is happening, the policy is happening, and I'm the only person that look like myself. So we don't want to just recruit and retain people to just do the direct care work, but let's expose them to policy because they know what the problem is. So when you are coming up the pipeline for you to be part of the solution, so they could sit at these various tables that I've been part of. So I could see a lot more people that look like me.
Yeah. Bravo on that. I think that's a round of applause. Any other comments? Dana. Bree's right behind you.
Again, it was really a pleasure to be here. This might have been discussed earlier, but as Mass Health is really moving forward with the community-based mental health centers, I think really working hard with the community health centers in terms of access. And I think that sort of dovetails with having more kids have access to Mass Health, but in addition to just really understanding how we can utilize them better. They're great programs. It's just they've been a little elusive still, and I think integrating better would be helpful for all of our folks. And I think that might be a year out, hopefully shorter, but I think that's a great goal because there's so much innovation and resources being poured into this in appropriate ways, and having us all continue to sit at the same tables is very important.
Yeah. And the CBHCs, I want to say they started January 1st, right? Was it January 1st? Yeah. So not like literally probably just getting established. So a lot of opportunity there, I think, for collaboration. Yeah. Charlotte's behind you there with a mic. Our remote audience needs to hear you too.
So I've heard a lot during the day about our little ones, but nothing really about our teenagers.
Yeah.
So, and I know that they are like, the parents are not in the room with them after, what, 12 years old, and then they're dealing with depression, their anxiety, substance, all of that, trafficking, all of those things. I'd like to see some more things done with them.
Yep. Thank you for that. Any other comments, suggestions? Well, then I will maybe take the opportunity to make a final comment, which is just a huge expression of gratitude to the Team Up team who's here today, all these folks around the room. You're going to have to forgive the corniness, but I couldn't imagine a better team to be teaming up with than these guys. How'd you do it? Oh, that hurt a little bit, huh? Yeah. Thank you to our funders who make all of this possible. Really appreciate it. So much thanks to all of the clinical teams, all of the administrative teams at the Team Up Health Centers that are here today. And who not only care for these kids and these patients and these families, but bring all of that knowledge and wisdom into Team Up and are the real strength and backbone of what Team Up is. Yeah. And then we have some external guests here today, folks who came from Rhode Island, from Boston Medical Center to share their wisdom and just expand us a little bit outside of just the Team Up little bubble. So thank you to all of you for coming as well. Really appreciate it. All right, with that, it is a wrap. Enjoy the rest of your Friday afternoon. Thank you again for coming. Take care.